Hello, welcome to Tips and Tea. My name's Linnea Baker. I'm a board certified family nurse practitioner. I'm excited to be here today and grateful for each of you for plugging in and showing up to listen to this week's presentation on metabolic syndrome. And this is continuing in our series on healthy heart, healthy brain, which is by Drs. Bradley Bale and Dr. Amy Doneen. Very excited to share this topic with you. This is truly an epidemic in the United States, and I'm really happy to bring some light to it, and it does fit in nicely with the book and with what we've been talking about. So I hope this brings you value. Today, I am drinking from my Netherlands cup that a dear friend got me, and so that is what my tea is in today. Now let's get started. Okay, when we talk about metabolic syndrome, the first thing we want to know is what it is. This is a word that is getting tossed around more and more. It's something that I was aware of in my medical practice over the years as a nurse and then nurse practitioner, but it's not something that most people understand the specifics on what makes somebody diagnosed with metabolic syndrome. So how do you get diagnosed? You have to have at least 3 out of the following 5 markers. The first one is large waist, and it's very specific. Women with a waist size of 34 or more inches and men with 40 or more inch waist size is one of the criteria, okay? And if you are a different ethnicity, then your numbers may vary, and they talk about specifics in the book. So like always, I encourage you to get the book to really get into the minute details that we don't cover because there's not enough time. Now, high blood pressure, according to the American Heart Association and American College of Cardiology guidelines, to diagnose high blood pressure, it's 130/80. Is the cutoff where it starts. However, 120 to 129 systolic, which is the top number, and anything less than 80 diastolic, which is the bottom number, that's where you're getting into going into high blood pressure or starting to be pre-hypertensive. But the cutoff for high blood pressure is now 130/80. They've lowered it. The goal is to get your blood pressure less than 120/80. That's the goal of what we want. Okay, low HDL. The HDL, we think of H as helper, good cholesterol. We've talked about HDL before in the different series I've covered. But in women, if your good cholesterol, your HDL is less than 50, or if in men it's less than 40, that's another criteria towards metabolic syndrome. High triglycerides of 150 or higher is the cutoff, and high fasting blood sugar of 100 or higher is considered metabolic syndrome. From 100 to 125 fasting blood sugar, or quote glucose, it's prediabetes, and if it's over 125 fasting, it's diabetes. So you would need 3 out of the 5 of these to meet the criteria. So if you have high blood pressure, but you don't meet any of the other ones, then you are not metabolic syndrome. 3 out of 5, okay? And we're going to get into details on why this is becoming, this is an epidemic in our country. So metabolic syndrome can actually be diagnosed at home by yourself if you've had the lab values already. How do you diagnose it? Well, you diagnose it off of those criteria I gave you. So if you've had fasting labs for triglycerides, your cholesterol panel, your blood sugar, and you went in recently and had a blood pressure check, and you can measure your waist at home, then you could decide even on your own if you have metabolic syndrome or not. The thing is that metabolic syndrome is highly treatable and reversible as a diagnosis. And a lot of people are like, well, how on earth is that possible? Based on optimal lifestyle, guys. And in the book on page 207, they talk about using the personalized therapies advised by AHA for Life plan with optimal lifestyle. So, guys, this is crazy. Only 1 in 8 Americans are metabolically healthy. That means about 12% of the United States adults are considered metabolically healthy. I am one of the people in that 12% group. When I look at all of my labs I've had done, my blood pressure and everything else, I'm in the metabolically healthy group. But I also live a very holistic and healthy lifestyle. And we're going to go through some things I've done that changed because I wasn't necessarily metabolically healthy before. And we'll go through that. Metabolic syndrome triples the risk of a heart attack and increases the risk of type 2 diabetes fivefold. Guys, it's an epidemic. Only 12% of adults in the United States are metabolically healthy. Metabolic syndrome affects over about half of the United States adults over age 60. But what's happening is it's an increasing diagnosis in adults of all ages, especially in adults in their 20s and 30s. It's happening at a younger and younger age, and it fits what we're seeing in the United States, where over half the population of US adults are either pre-diabetic or diabetic. Most don't know. It fits that unhealthy lifestyle that we talk about in the United States that has been normalized with the high stress, lack of sleep, ultra-processed nutrition stripped of fiber, and sedentary jobs and sedentary lifestyle. So those are all things that work against us, and that's why this is an epidemic. There's no judgment here. I've been there, guys, and I get it. And that's why I'm on this platform sharing with you all the things that I think could really impact you and empower you to take care of yourselves and have better quality of life and longevity and a health, quality of life with improved health. Okay. So next, metabolic syndrome. What chronic diseases are associated with the syndrome? Well, there's a snowball effect, they call it, of metabolic syndrome when it's undiagnosed and untreated. So when you have metabolic syndrome, it's associated with atherosclerosis, strokes and heart attacks, fatty liver, obstructive sleep apnea, polycystic ovarian syndrome. I was seeing this in younger and younger people, and it's more and more common nowadays. Sleep apnea is very common too. Fatty liver, I was seeing that in kids, and I had fatty liver, and I'm going to talk a little bit about that, but I was seeing that even in kids. I was having to send to a gastroenterologist specialist, a GI doctor, a pediatric GI doctor, because they were having fatty liver as kids. Gallstones, diabetes, cancers of liver, colon, bladder, breast, uterus, and pancreas, as well as Alzheimer's. When untreated, metabolic syndrome can double to triple the risk for early death due to heart attack, stroke, sudden cardiac death, cancer, and other causes. That's why it's so important we educate ourselves on what this is. And then there are so many things we can do with our lifestyle to treat and even prevent or reverse the disease. Fatty liver disease. It's an obesity-linked disorder, and it affects about 25% of the adults. It's up to 6 times more likely that someone with fatty liver disease will develop diabetes, type 2 diabetes, in the next 5 years compared to those with healthy livers. It is reversible with weight loss if you catch it early. So I was starting to have signs of a fatty liver when I worked in the clinic, and I was not, over 3 years ago, I was not taking good care of myself. And so I did have to go see a specialist. I do have an autoimmune disease. They say that fatty liver and liver things can kind of, well, not necessarily fatty liver, but liver disease can go with it. So they wanted me to see a specialist. And I will tell you, in the meantime of me trying to get in with the specialist, I had already started my healthy lifestyle over 3 years ago, where I started with the nutrition, sustainable, holistic lifestyle, and then just building on that, and eventually changing a career to be home-based with my holistic health and wellness business and not be in the clinic working. And in all the things I did to improve my lifestyle, guys, the enzymes have normalized in my liver, and I've reversed the disease. Yes, it took some weight loss. It took being intentional. Now this is my normal lifestyle, and I don't even think about it. Back then, I was living the typical American adult lifestyle. I was exhausted. I did exercise routinely to a point. I would say I tried, right? Like most of us, you're so exhausted and zombified, you don't want to do anything. And I was drinking lots of diet soda, and I was eating ultra processed foods. And I didn't think I did that bad, but clearly my body, it took a toll on me. And I have been able to reverse and improve a lot of things since then in just baby steps, progress over perfection. And that's why I'm so passionate about what I get to do now to help others get on a health journey that can be sustainable and holistic and not feel like you're sacrificing or giving things up. So what about obstructive sleep apnea, or OSA? I put this picture up there because my husband has sleep apnea, and I mean, it is like the walls caving in when he doesn't use his CPAP. But Really, with obstructive sleep apnea, it really frequently occurs with people with metabolic syndrome. And it happens so frequently to coincide that there are scientists saying they want to add the OSA or obstructive sleep apnea as another diagnostic criteria for metabolic syndrome. Now, I will tell you, my husband does not have metabolic syndrome, but he's probably close. He's probably close to having it. So we are working with his lifestyle on things to reverse it. But people with obstructive sleep apnea are 40% more likely to have metabolic syndrome than those without it, even if they're not obese. Okay. And obstructive sleep apnea increases your risk for fatty liver disease, heart attack, strokes, and diabetes. So diagnosing and treating the sleep apnea is so important, guys. And also doing the other holistic and healthy lifestyle things to optimize your lifestyle so that you live that healthier, longer, higher quality of life. Okay, exercise and chronic disease, guys. So regular exercise helps treat or prevent over 40 diseases to include, and this comes from the American Heart Association's 2018 scientific statement. So in these over 40 diseases, some of them that exercise helps treat or prevent is diabetes, so type 2 diabetes, cancer, cardiovascular disease, obesity, Alzheimer's, and arthritis. Physical inactivity kills more than 5.3 million people prematurely globally each year. And that is actually, and this is astounding, guys, that's more than die prematurely from smoking. That's how important regular exercise is. There are so many benefits to regular exercise. So let's break down metabolic syndrome when we talk about one of the criteria, the large waist. When we're talking about large waist, we're talking about excess belly fat, which is really called visceral fat. It's fat around your organs, and that's more of an apple-shaped person. Like I said, no judgment. This is just to give you guys visuals of what we're looking at and why. And the type of fat there is considered metabolically active fat, and that actually has compounds that contribute to that chronic inflammatory cycle, that spark that's feeding that fire throughout the body that sets us up as the playground for chronic disease. It sets us up and contributes for insulin resistance and high blood pressure. And all of that, as we've been talking about, increases the risk of cardiovascular disease and other chronic diseases. So if you want to measure, and it's really crazy because all the years I spent working in healthcare, whether it was inpatient, outpatient, all the things, we never measured anybody's waist. But truly, this is actually one of the criteria for diagnosing for metabolic syndrome. So it's crazy to me that we never measured anyone's waist. But you can measure yourself at home using a tape measure, and you actually want to hold that tape measure around the top of your pelvic bones. And in the book, they said where the love handles are located. Make sure you exhale before measuring. A lot of people will try to suck in their belly or posture differently. You want to just be at your comfortable, normal, exhaled position. And don't use your belly button. I think that's a misnomer. A lot of people think your waistline is where your belly button is, but that can be inaccurate because people's belly buttons are off a little bit. They're not exactly identical in the same location. Don't do that. Use the top of your pelvic bone. And for men, this is one. Men will usually use their waist of their pant size, and that's very inaccurate. So that does not count. You have to actually measure it with a tape measure. So in metabolic syndrome, if you have, and separate from metabolic syndrome, say you have a large waist, but you don't necessarily have metabolic syndrome, how do you treat it? Exercise, combining aerobic exercise with strength training. So when we say aerobic, we're talking walking, jogging, bicycling, or cycling, swimming. Strength training is weightlifting or resistance training with a goal of 30 minutes of exercise daily. And if you combine the above with the healthy and sustainable nutrition plan, that is going to be really powerful for helping your waistline. I will tell you the coaching and the individualized plans I do for people, and a lot of people actually do have a weight loss goal. It's not even just about the pounds lost. It's about the type of body composition and how much muscle. And I will still see people that I work with who, yes, they lose weight, but the amount of inches they lose off their waist, the amount that they change in their clothing size is absolutely astounding because of how they're taking and changing the body composition to more muscular and less of the fat. And then stop drinking sodas. I was a diet Dr. Pepper fanatic. Before that, it was like diet cherry Pepsi and diet Coke. Stop drinking sodas, because they say even just one soda a day increases your risk for metabolic syndrome and diabetes by 20%, guys. I never drank regular sodas, but even when I was drinking the diet sodas, all those artificial sweeteners are actually toxic to our body and also set us up for inflammation, because our body does not recognize them, because it's not real food. It's not real ingredients. It's chemicals that are triggering your body. So all the artificial sweeteners, and then the sugar, the amount of sugar that they load in a can of soda, all those things increase your risk of diabetes. So stopping drinking soda is one habit that you can swap out. And I have swaps for you if you get with me and want coaching and an individualized plan that can drastically change the trajectory of your health. Okay, high blood pressure. So again, you may have high blood pressure or pre-hypertension without having metabolic syndrome, or it may be part of that diagnosis. But what can you do? Well, first, you want to get your blood pressure checked by your personal healthcare provider. And just know that typically medication is going to be needed to treat the high blood pressure, at least early on. And also depending on what other diagnoses you have, because the blood pressure medications, my background's cardiology as well. The blood pressure medications we use typically have multiple things they do to help with the arterial lining, and we're talking about unhealthy arteries and atherosclerosis. So there's a lot of anti-inflammatory and effects and remodeling that happens when we're on some of these types of blood pressure medications. So you may need it short term, you may need it long term. Just be aware that that's a very high likelihood. Okay. But there are some things you can do alongside needing medication, or maybe you're not quite there where you have a high blood pressure diagnosis and you want to do healthier things in your lifestyle to avoid having to go on medication because you're catching it early enough. Well, how do we do that? Well, the number one reason for, other than having things on in your body and genetics, is stress. We have to reduce stress. And in the United States, we are inundated constantly with the technology and the news and the shows and reducing stress. How do we manage stress? Well, exercise can be a stress reliever, meditating, praying, those kinds of things can help manage and reduce stress. So finding a healthy outlet to manage and reduce your stress. I mean, for some people, if they're able to even change jobs, that may be something that needs to be done. Everybody's different, and you know your situation best. Also eating foods that are loaded with magnesium. So dark green leafy veggies, unrefined greens, and legumes. This all comes from the Healthy Heart, Healthy Brain book. Sleep. I've talked about this a lot. Sleep is like a medicine. And when we don't get enough sleep, we do so much damage to our body. And you need at least 7 hours of sleep at night. In the book, they say 7 to 8 hours, but 7 is the gold standard. Of 7 hours of quality sleep does so much for so many aspects of your health, but it will also help in your blood pressure, in watching and making sure that you're doing everything you can from a lifestyle approach to help your blood pressure. Okay, what about lowering HDL? What having low HDL cholesterol? How do you treat that? Whether you have just low HDL cholesterol or you have metabolic syndrome because you met the 3 out of 5 criteria. Well, if you smoke or use any kind of nicotine tobacco products in any form, quit. And there's several studies that link quitting this use of nicotine or smoking that links to increased HDL, which is the H is helper or good cholesterol. Also getting your omega-3s through eating oily fish and other foods high in omega-3s. So oily fish would be like salmon, tuna, sardines, but other foods would be flaxseed, chia seeds, and walnuts. These foods also help reduce inflammation. And we know that chronic inflammation is the spark that triggers the playground for disease, right? When we have ongoing chronic inflammation. For many chronic diseases. And then olive oil is a healthy fat that can raise the HDL, and it also is loaded with heart healthy antioxidants. So that's another food that to add into your nutrition. Okay, what if you have high triglycerides, whether it's because you have metabolic syndrome or it's just isolated and you don't have the 3 out of 5 criteria yet? How do you treat that? So In overweight people, it says if you lose 5 to 10% of your body weight, that's going to help increase your triglycerides by 20%, guys. And so if you're a 200-pound person, you're looking at 10 to 20 pounds, which is completely doable. I work a lot on this with a lot of clients, and totally doable. You want to do it in a healthy way, because just starving, and remember, I've told you, just calorie cutting and over exercising, that is not how you decrease inflammation and improve your overall health. It has to be done in a healthy way. And that's why I do health and wellness consults to help you with that. Nutrition wise, if you can limit or avoid refined sugars and also increase your fiber in your diet. In the United States, we eat, I told you guys, about 60 to 70% of an adult daily nutrition intake is ultra processed food. And what happens is we're not getting the fiber, and the fiber we need in our nutrition, they say for women, it's 25 grams a day. We're not even coming close to that. And it's actually probably even more than that. But that's what the RDA recommends. And when we eat ultra processed foods, it may say that it has fiber in it, but the fiber was stripped away from the food in the processing, and then they try to add it back in. And that is not the same as eating real food with fiber. And because of that, we're starving our good gut bacteria, and our gut health is crummy, it's unbalanced, and we have more unhealthy gut bacteria than we do healthy. And that's impacting our overall health, metabolism, weight, brain health, immune system, and literally leading to chronic illnesses. The good gut bacteria, they are responsible for making vitamins and short chain fatty acids. There's so many things. It makes serotonin. So because it has such a role in it, we have to feed the good gut bacteria the food it needs. And the food it eats, what is prebiotics? It's fiber. That's what we need. Different types of fiber, not just one, not just going and getting Metamucil over the counter. Different types of fiber from food. And that's something I work on with clients too. Fiber is so great for so many things. And we don't get it in our normal American culture in our diet. And then vitamin D, having your level get checked by your healthcare provider, which is a lab draw. We've noticed that vitamin D, when it's low, it can actually increase your risk of high triglycerides as well as other lipid abnormalities, and even contribute to metabolic syndrome. So vitamin D, we're starting to see it plays a huge role in a lot of things, but these were some things that the book pointed out. So getting your lab work done by your healthcare provider. Okay, having a high fasting blood sugar level, if you do have this, whether it's part of the criteria and you met the criteria for metabolic syndrome or not, how do you prevent or reverse prediabetes? The number one way is aerobic exercise, whether you're running, brisk walking, biking, or swimming. The American Diabetic Association actually says that even walking slowly greatly improves insulin sensitivity for the following 24 hours. And when we say prediabetes, we're saying insulin resistance. And that just means that your body's not responding. The glucose is not responding. The cells are not responding. The cells are not responding to the insulin in the same way. So it's taking more and more to shove that glucose into the cells and out of the bloodstream. And so when you exercise, you can improve that sensitivity. So it's talking easier and communicating better to get the glucose out of the bloodstream for the next 24 hours when you're pre-diabetic. Exercise, okay? Now, I already told you guys that over half adults in the United States, I think it's around 52% last I heard, are pre-diabetic or diabetic, and most don't know it. It's an epidemic in our country, just like metabolic syndrome. Remember, only 12% of adults in the United States are metabolically healthy, and metabolically healthy means they don't have when you look at metabolically healthy, all 5 of the criteria for metabolic syndrome, they don't have any of those. Waistline, blood pressure is normal, no trouble with triglycerides, no trouble with HDL, and the fasting blood sugar is normal. Okay, so in saying that, it's crazy, guys. You would think that 12% would have metabolic problems, and what would it be? 88% of the country would be metabolically healthy. It's not that way. And that's really sad. And that's why we need to do better. But how do we do better? We need to know better to do better, because this isn't something that many of us know, not even me going through the different schooling. It's not things that we are taught enough to the extent where we know how to help people, because the majority of people are going to tell you in medicine, you need to eat less, exercise more. Well, they're right. You do need to exercise more. But being specific, when you're going for a brisk walk, you want to walk so that if you were trying to carry a conversation, you'd be a little winded trying to talk and keep up a conversation with whoever you were walking with. Now, anytime you're going to start any kind of physical fitness routine, new exercise routine, if you're following with a healthcare provider or specialist because you have, you're on medication, you have a chronic disease or illness, whatever that is, you need to check with your healthcare provider just to make sure that whatever you're doing, they're okay with based on your personal diagnoses, conditions, medications, okay? Just for safety. Of course, they're going to be so happy, I'm sure, that you want to get up and get moving. And do things to better yourself, but we want to make sure you're doing it safely. So your personal healthcare provider or specialist following you is the one that knows you best, and they can give you the best guidance. It can be so much as an email or a quick phone call to the nurse and leave a message and just make sure you don't have any restrictions or things you need to be careful on. And when you're starting an exercise program, once you clear it with your specialist or healthcare provider, you want to start out slow if you're not used to exercising. If this is brand new, you don't push yourself. You start out slow and you build up to that time, okay? You don't need to try to be a hero out the gate. That's how people get hurt. Your body needs to get used to it and conditioned to it, but you'll be amazed at how you improve with little increments of consistency over time. Also, exercise is proven to prevent prediabetes from progression to full-blown diabetes 60% of the time, and when you and it increases to 70% when you add exercise with moderate weight loss, and we're talking 5 to 7% body weight, guys. So 10 to 14 pounds if you're a 200-pound person, and that's easy to do. I do that all the time. I mean, we say progress over perfection, but I have found ways to really be able to help people to make it so it's not restrictive, it's sustainable, it's something you're going to love and choose to do. We talked about soda. I've had so many clients, especially recently, reach out to me and say, Linnea, I don't even like the taste of soda. Like, I try to sip after maybe 2 weeks of following the nutrition program you gave me and working with you. And I thought, well, I'm just going to try it. And it tasted disgusting. It was like drinking straight sugar. And that's because when we get your gut healthy and we start detoxing and resetting your gut, it's amazing that your taste buds change too, because the ultra processed foods we're eating are so hyper palatable and loaded with sodium and sugar that when you start getting that out of your system, and I say detoxing, like eliminating all those things out of your system and getting your body to eat more intuitively and more nutritious foods that aren't all hyper palatable and loaded with all those types of chemicals and things, it's amazing what transforms, guys. It's incredible. And it becomes so easy. I don't even like the taste of diet soda anymore. And that used to be my go-to from college all the way up until 3 years ago. And I can't stand it. And I don't look at it. And I used to not drink water. I know how bad that is. But now all I do is crave water. And I don't want any of the sugary stuff or even the diet stuff that I used to drink, the diet sodas. It's crazy. All right, what about insulin resistance? So in 1999, there was a groundbreaking study that said, actually, and we're talking about atherosclerosis and arteries and the health of our arteries, arterial damage. So the damage to the blood vessel lining of the arteries where the oxygenated blood flows throughout your entire body, it actually starts at the onset of insulin resistance. And it continues to progress as the pre-diabetic condition remains untreated. And didn't I say over half the adults in the United States are either pre-diabetic or diabetic, and most don't know it? So this is silent and happening behind the scenes and inside, and you don't even realize it. And as soon as you become insulin resistant, you're set up for the perfect storm, because at the cellular level, things are changing and happening that affects all the arteries in the body. And that's because I've said before, all your arteries in your body are made of the same material and lining. So if you have heart disease, you're at risk of carotid artery disease, which is the vessels in your neck, or femoral artery disease, which is the blood vessels in your legs. Anywhere in your body that you have arteries, it can be affected because they're all made of the same thing. This back in early 2000, I had this amazing cardiologist I worked with called Dr. Schwimp, who has since passed on. And he was an amazing mentor of mine, an amazing physician. He was way ahead of his time. And I just loved getting to work with him and shadow him. And he used to say this immediately when I first started working with him years ago. And this was in the early 2000s. He said, all the blood vessels are made up of the same thing. So if you're coming here with heart disease, we need to worry about your other blood vessels too. And insulin resistance is an inflammatory disorder. Remember, we talked about chronic inflammation. When you have insulin resistance, that's showing us that you have inflammation in your body, and you're setting your body up for the playground for chronic disease. Okay. So really important that we are doing things to get these diagnosed early. First, we want to optimize our lifestyle, but we also want to make sure we're following with our healthcare providers and getting these tests done and staying on top of things. So if anything's changing, we catch it earlier rather than later. By the time someone's diagnosed with type 2 diabetes, they've already had arterial damage occurring for at least 10 years and sometimes even 20 years, it's said in the book. And then also you're at risk of Alzheimer's. They're now talking about Alzheimer's being the type 3 diabetes. They actually wanted to name it type 3 diabetes because when you have insulin resistance, it creates inflammation. And they're finding that people who are pre-diabetic and insulin resistant and even diabetic, that they're putting them at significantly increased risk for Alzheimer's. Okay. So in insulin resistance, the American Diabetic Association actually advises to get screened if you are 40 years or older. Okay. Now, you may get advised to be screened at a younger age by your healthcare provider just based on certain risk factors. So go with what your healthcare provider says. But if not, by 40, you should be getting screened. I was screening kids sometimes in clinic with different blood tests and things. We talked about that I've done cholesterol in kids before, and now it's a standard to be done in kids at certain ages. And we talked about that in one of our series, in part of this series earlier on. So if you haven't seen it, go back and watch the different weekly series for the different, weekly presentations for this series, because each week we build on it. Now, the gold standard test, many would think of fasting blood sugar level or an A1C, a hemoglobin A1C. But actually, the gold standard test is a 2-hour oral glucose tolerance test. If it's less than 140, and they'll do blood sugar lab measurements, glucose measurements at certain times during the test. So if it's less than 140, it's normal. If it's 140 to 200, you're pre-diabetic. And if your glucose level is greater than 200, you're diabetic. And the danger zone for insulin resistance on a 2-hour blood sugar is 120 during the 2-hour oral glucose tolerance test or higher. And if you're doing a 1-hour blood sugar result at 125, you're considered pre-diabetic. Now, we talked about, well, what about the A1C? The hemoglobin A1C is really common. Well, it's not as accurate for detecting insulin resistance in prediabetes. And actually, in 2011, the Baldonine study, which we said this is the Baldonine book and their method, they actually presented on this. They did a study, and in the study, the hemoglobin A1C missed 63% of persons with insulin resistance or prediabetes, guys. That's over half. That's almost 3/4. So the best thing to do is get your 2-hour oral glucose tolerance test to be sure. So what are our action steps? Well, first, if you haven't been in with your healthcare provider recently, you need to make an appointment, get in, get your blood pressure checked, get some lab work done, check your fasting cholesterol levels with your triglycerides, your LDL, your HDL, have your fasting blood sugar checked. If you're 40 or over, make sure you're getting in for the 2-hour oral glucose tolerance test to be sure. If you're younger, your doctor may recommend the test anyway, just based on risk factors. Start that daily 30-minute exercise routine. Remember, start slow and build up. But if you have a chronic illness, taking medications, followed by a healthcare provider, followed by a specialist managing you for some reason, or if you're pregnant, go ahead and double check with your healthcare provider. You can even just do an email or they usually have secure messaging now, or you can leave a message with the nurse. As long as you've been in recently. If you haven't been in recently, get in and get checked, because we don't want to do any harm. And then before we start any kind of change in our nutrition program or any kind of change in our exercise program, when we're followed by a specialist or healthcare provider because of certain diagnoses or medications, we want to make sure they give us their blessing and tell us what we should and shouldn't be doing, because they know you best and we don't want to do any harm. Now, you can reach out to me to schedule a free health and wellness consult so I can go through some things you're doing and kind of get a better idea of where you're at and personalize a plan for you. Obviously, I don't replace the guidance of your healthcare provider. So if you haven't been seen by your doctor recently, I've had plenty of people that I've said you need to go in and get seen and get some labs. And if you're comfortable sharing them with me once you talk with your healthcare provider, great. More information's great, but I can't do the labs or do that part for you. So I will tell them they need to go in and get that because it gives us so much more information to work with. And then refer your friends and family members you care about who need the support and guidance on getting healthier and living a holistic, healthy lifestyle, optimizing their lifestyle. Send them over to this Facebook group, Tips and Tea, or I also have a YouTube channel, Tips and Tea. It has my picture on it, and let them follow the series so that they can get this information as well and send them to me. So maybe they want to get a consult or ask some information and see what I can do to help them. Invite the friends, like I said, to this or family to this private group so they can hear the information. Really, a lot of the information we're talking about, especially in this book, is life-saving. And what I do is I'm passionate about helping people on a holistic and sustainable, healthy lifestyle, optimizing your lifestyle to give you the best quality of life and improved health and longevity alongside what you're doing with your healthcare provider and specialist, right? And hopefully maybe even preventing, because we're living a healthy lifestyle, maybe being able to delay or prevent things from happening because we're taking care of you before anything's a problem. I was diagnosed with an autoimmune disease and fatty liver. I've reversed the fatty liver. My autoimmune disease is very stable at this point, and I'm grateful. And it came down to me taking charge of my health by changing my lifestyle and doing each of the things I talked to you guys about. And I've walked the walk. I don't just talk the talk. Recently, I've had people coming up to me that say, "Hey, you live in my neighborhood. I see you walking all the time, and I don't even know they're in our neighborhood." And it's awesome to hear that because people see I walk the walk. I literally walk almost every day. And I do different things with friends to do strength training and aerobic exercise. But I do this because I know the importance with my overall health of what I need to do to maintain my health, to give myself quality of life and longevity. And I do this alongside my specialist who manages my autoimmune disease, my personal primary healthcare provider, and getting my routine checks because I want to do everything I can possibly do to live well and be around a long time for my grandbabies. Guys, as you can tell, I'm very passionate about this topic. I'm on a mission to positively impact your health and wellness through education and coaching to create generational health and a health span that equals your lifespan. Reach out to me for that free health and wellness consult. You can comment below or private message me, and I'd love to get to talk with you. And remember, the book that we are using, that I'm getting the information from, is Healthy Heart, Healthy Brain by Doctors Bale and Doneen. This is something I bought on Amazon that you can buy too. It is written in layperson's terms, so you do not need to have any kind of medical background to be able to read this book. It is a wonderful resource to help you, empower you, and help you advocate for your health and to understand why certain tests are being recommended or what you need. It's beautiful. They even have cartoon type pictures in it that give you explanations that break it down visually for those who are more visual. I bought the book. I have nothing to do. I don't get anything from this. I thought it was so powerful. And with my background in cardiology and pediatrics and all the things I've done in healthcare for 25 years that I've been grateful and blessed to do, this is a book that I highly recommend. And you can even bring it into your healthcare provider to have those discussions. Okay. Guys, until next week, just know that I hope you're safe and I am grateful for you. And I hope this brought you value. I will talk to you guys soon. I look forward to seeing you again in a week.